Every day, every minute, a woman dies in pregnancy or childbirth. And for every woman who dies, 20 more experience serious disabilities. Of these 500,000 annual maternal-related deaths, over half occur in sub-Saharan Africa. Nowhere in the world are a woman and her baby less likely to survive than here, in the newest nation of the world, South Sudan. There is a saying among the Dinka tribe that has herded cattle on the arid plains of this sub-Saharan region for centuries. A wife is worth the cows paid for her only if she produces many children. The fact is that 1 in 6 women die from pregnancy-related causes in South Sudan. In a country with 10 million people and less than 20 fully trained physicians, these women face death every time they give life. The added and sad truth is that 1 in every 4 children will also die before 5 years old. In 2005, after 5 decades of violent civil war, the largest country on the African continent finally split in two with the signing of the Comprehensive Peace Agreement. On July 9, 2011, South Sudan will officially become a democratic republic, but the challenges of nation-building remain ahead. For the past 2 years, Massachusetts General Hospital's Division of Global Health and Human Rights has been in country, partnering with this fledgling nation to improve its daunting maternal and child mortality rates. The most tragic statistic is that 95% of these maternal and childhood deaths are preventable. With an innovative frontline rural training program, Mass General's global health and human rights workers are proving these terrible odds can be reversed and become the best hope for South Sudanese mothers and babies. 95% of mothers and babies can survive.
So the program is really an innovative and an action-based program that was put together in what we consider a best evidence fashion, which is where we did probably for a couple of years an enormous amount of homework trying to find out what is the greatest opportunity to address the maternal mortality ratio in South Sudan. By the way, 1 in 4 children dies before age 5 as well, so it's not just about mothers, but it's about babies and children as well. We created a package, and this package has 3 different main features to it. One feature is that of an intensive, action-based, and really case-based training for frontline health workers. When I say frontline health workers, what I mean is people that are at the front lines that are taking care of mothers, babies, and children. And they could be doctors, but since they don't have very many doctors, probably not. They could be clinical officers, midwives, or traditional birth attendants or community health workers.
My name is Joyce Dominic Nazario. I'm a medical student in Juba University. I have finished my 4th year by now, and I'm going to start my new academic year, that is 5th year, in next May. For us here in Southern Sudan and all the 10 states, we have like a high number of maternal mortality and morbidity. And if we are searching for the causes of this, we can see that on the top of the list we have like the traditions done by tribes. For Lotuka tribe, if they found a woman bleeding, they do beat her with leaf, thinking that the leaf is going to stop her bleeding.
I've
started to work as a midwife since 1984. It's a long time. Sometimes in a month I can deliver like 5 or 3 women. It happened that once during the process of delivery, a woman died because of postpartum hemorrhage, and 2 cases where the family or the community members, they brought her 2 pregnant women, and it was like even too late for her to save them. She transferred them to the hospital and they died there.
My name is Manisha Kumar. I'm from Dayton, Ohio originally, but right now I'm a resident in family medicine at Brown University in Providence, Rhode Island. What I really appreciate about this project is that the way they're going about helping out is by training local nurses and midwives who are then responsible for training the frontline health workers.
And so it's all these different sectors and sections of people working together to kind of accomplish the same goal, which is to decrease maternal mortality.
Yeah, to me I feel that is very key, because
most of the problem is at the community level. And now the approach is bottom up.
So frontline health workers training. The second one is we use checklists, and we use checklists that are specifically designed to be pictorial, since most of the frontline health workers are actually illiterate.
But every picture tells a story. So when the frontline health workers get these and they're explained what the pictures meant, they're able to refer to this as a guide later on when it comes to something like dealing with heavy bleeding during a delivery.
Another thing here, we go to day 2, we have like the danger signs in pregnancy. The danger signs, this picture here tells us like this woman, there is something red here, and always when it comes to red, it is danger. And this picture here tells us like she is swelling. It's swelling in her hands and it's swelling in her face.
A rural workshop in eastern Equatoria produced a surprising development. TBAs, midwives, and master trainers spontaneously began incorporating their checklists into native songs and dance.
But now you people, you have come, you especially you, the white people, bring them the knowledge about showing from the pictures in which they don't know before. The pen and the paper, they don't know how to write and how to hold the pen, but they work before with their hands. This is the meaning of these songs.
So it's checklists, training, and then the third component is a bag of reusable commodities. And that's critical because the supply lines are either non-existent or poor. So we've very carefully chosen supplies that we think have a high opportunity to save a life, but yet are able to be reused.
This bag includes like the commodities that they will be in need while during the process of delivery. Here there is a bag of gloves. It contains like 50 gloves. They are to use it, and we do teach them that the gloves, they are not reusable. We have also this thing here. This is something new. It has been invented recently by the team of Dr. Burke and Dr. Maya. This is known as a uterine balloon, and this uterine balloon is to be used in the case of postpartum hemorrhage. This is a breathing bag for the baby. Like when the baby is not crying after delivery instantly, we do use it for him in order to stimulate ventilation.
Now when I want to use this airbag, I want to position the baby so I am standing here on the baby's head.
This morning when we were doing the process of newborn care, that is, we have like a model and the child has been delivered, but the child is not crying and is not breathing. And for the first time when Dr. Menisha was doing this, and like we got the child, now he was not breathing. She did the steps 1, 2, 3, and finally the child started crying and started breathing. Like one of the trainees have started crying. And this is not just the first time for me to witness that the project has its effect in their lives.
You know, the birth of a child everywhere in the world is celebrated with enthusiasm, and it's absolutely true in Africa as well. However, something that we can't even imagine is the risk that occurs. And so there are parts of Africa where mother and baby are in hiding for 3 days to see if they both survive. And if they do, you know, then the celebrations continue. There are places in Africa where they have a saying such as Mwapusukeni, which means, thank goodness you survived.
I would like to say for all people, whoever lives in Southern Sudan, you must to have a heart towards this country, because people are in need. Your family are in need of such kind of help, no matter if it in health section or any other section of this life.
The development needs of Southern Sudan are absolutely mind-boggling. They are enormous. For example, there is virtually no health system, there is virtually no educational system in the country at all. Southern Sudan is a country the size of France. The road system is almost non-existent for much of the year. We are currently building the first paved road in the history of Southern Sudan. The government of Southern Sudan chose the road because they see the road as a lifeline. Almost everything is imported from Uganda and from Kenya, and it comes up that road. I have seen in too many places in Africa the edifice complex, where the concentration is on putting a building in place, building a hospital, building a school, all right, because it's thought, well, you've got the building there and that will show progress. But so often the building ends up empty. If you don't have nurses, if you don't have trained midwives, if you don't have trained physicians, if you don't have the medications, then what good is a building?
So the challenge is the manpower all across from the ministry, state up to the down level. Manpower is an issue, skilled manpower.
The government of South Sudan recently endorsed the Maternal, Newborn, and Child Survival Program as its national methodology. In just 6 months, the trainings have expanded from 3 to 7 states, with plans to reach all 10 states of this developing nation within the year.
So we had 21 trainees in our first training program. Village midwives, frontline health workers, community health workers. They deliver babies in ways that we don't even think of. With their lost arts, they know how to, turn a baby that's upside down to right side up. They know how to deliver the breeches in ways that we wouldn't even dare, deliver. So there's actually, they have knowledge and skills that we actually don't even have.
Yes, she gave birth to an estimated number of 573. During this process, I have seen that you people who came from the United States, who come from far away up to here to teach us all these things. You are doing it in a good way. We are supposed to follow this track that we are to help each other by one heart.
It's a very interesting time right now. There's this great sense of hope that you see everywhere, and there are tons of different tribes all over South Sudan, but everybody kind of has this really great vision for what they can become. Everyone's looking forward to joining the East African community and keeps talking about, well, we're going to open up trade, we're going to start learning Swahili, we're going to send all of our children to school. It's just something that it's a really great opportunity. A lot of other developing countries don't have the sense of a fresh start.
When I see people around me, they're happy, I'm happy. Another thing I can say that I'm happy because the project is going well fine. The trainees, they are cooperative, and each morning you can see them, they are eager to learn a new thing. And that means that's something positive for the country. This is something positive because now we are in a process of building a new country, and this is a huge thing for us. Like the first beginning, it's always hard, but like when having people are eager to learn, are eager to give a helping hand, I'm sure that soon and very soon we are going to have the independent country, South Sudan, that we have always prayed for, we have always willing to get, and that country that lots of people died during the war, so that they are going to achieve it.
Obiero wa yuagui dalawai bye-bye. Obiero wanto wane wa yuagui dalawai bye-bye.